Do you suffer with fibromyalgia? Well, we can help you, and we offer a money-back guarantee to prove it. Hi, everyone. I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983. So I've been in natural healthcare since 1983, and that is almost 40 years. Excuse me. It's cold and flu season here, as you can tell by my screen. That's Bayfield back there. That's where I'm going this afternoon. It's up on Lake Superior. Well, I'm the author of a couple books. This one, What Do You Do When the Medications Don't Work? Non-drug treatment of dizziness, fibromyalgia, migraine headaches, and other chronic conditions. And this one, You Can Beat Thyroid Disorders Naturally. A lot of fibromyalgia patients have thyroid issues. So we want to be as thorough as possible. How are we going to help you? We're going to have you do home therapies every single day, multiple times a day, maybe 2 or 3 times a day. You're going to be using a laser. You're going to use laser therapy. We may do some frequency therapy. We may have you into the office if you're a local patient. We have patients from all over the country, literally all over the world. So if you're a distance patient, we just have you do things at home, although we do have distance patients that they do visit us for a few days, a week, a couple weeks. It depends on their schedule. We do complete blood work. We want to look at everything. All of your organs, functions, liver, kidneys, abdominal area, your stomach, your inflammation. One of the things we look at that causes a lot of symptoms with fibromyalgia is high ferritin, high iron. If you Google high iron and fibromyalgia, you'll see what I'm talking about. That's not good. Normal ferritin level should be 20 to 50, 30 to 50. We've seen people 500, 1,000, 2,000. If you have high ferritin, you have severe inflammation. You're going to have a lot of pain. You're going to have a lot of fatigue. You're going to have numbness, tingling, burning, a lot of the symptoms you are having. You're going to have chemical sensitivity. You're going to be sensitive to light. You're going to be sensitive to everything. Massive inflammation. We need to eliminate toxins and infections. This is one I didn't know, one that I was doing. Do you know that with bottled water, they filter that water through aspartame filters? So that way it doesn't have to say that it contains aspartame, but it makes the water taste better. I mean, I'm drinking bottled water all day and I find out about this, and sure enough, I'm loaded with aspartame. So there are specific protocols that we utilize to remove toxins, to remove infections from your system. Because those toxins and infections can cause your immune system to attack your body. You can be autoimmune. Many fibromyalgia patients have autoimmune issues. I have multiple autoimmune issues myself. You need to get rid of cheap, inferior supplements. And a lot of fibromyalgia patients say, look, this is all I can afford. I get that, but I'd rather have you not take them than take the cheap stuff from Walmart or Costco or Sam's Club or Walgreens or CVS or wherever you're getting them. Because a lot of those B vitamins are made from petroleum-based products and it messes up your liver. The vitamin D is made from sheep's wool. Again, toxic to your liver. And clearing your liver is really important. Liver detox phase 1 and 2 with fibromyalgia is huge. Lifestyle changes. Look, if you have fibromyalgia and you smoke, don't contact me. You're not serious about your health. I will have nothing to do with you. I do not take smokers as patients. Period. You're not serious about your health smoking 2 packs of Marlboros a day. Okay? It's just not going to work. You want me to sprinkle fairy dust on you and magically you're going to be better when you're a smoker and you expect me to help you get better. You got to have some skin in the game. You've got to make some lifestyle changes. Get rid of the refined sugar. All right? Go on a much better diet, perhaps even a ketogenic diet with fibromyalgia. Just depends on the patient. Some people can do keto with fibro, some people can't. Again, this is all patient dependent. No 2 fibro patients are the same. You're going to have to stop drinking the Diet Coke and Diet Mountain Dew. I mean, I've seen people drinking a 12-pack, the 12-ounce cans, a 12-pack of Diet Mountain Dew a day. You got to stop. Alcohol, caffeine, you've got to stop, at least for 6 months. This is your health. You've got to have some skin in the game. You want me to help you and at least get you 70, 80, 100% better, but you don't want to do anything to get better. That's not acceptable on my end, because I'm going to end up giving you your money back because you're not going to get better. So after 12 months, you're not better by at least 70%, I'll give you your money back. But we don't accept everyone who presents to the program. That's the key issue. Not all are accepted. If you'd like to schedule a consultation with me, either by Zoom or by phone, we talk about your case, and then we have you fill out a little questionnaire, and then I decide if we're going to accept you or not as a patient. You're welcome to contact me via email. It's drmlj83@gmail.com. That's Dr. Dr. MLJ, Michael Lee Johnson. 83 is when I started my practice, at gmail.com. drmlj83@gmail.com. I'll have all this information down below. Take a look at it. If you're interested, great. If you don't want to make lifestyle changes, that's okay. Nothing wrong with that. That's entirely up to you, but don't contact me, please. If you don't want to do therapies at home, that's okay. That's fine. Please don't contact me. I will not accept you as a patient unless you're willing to work with me. Like I said, I'm not some magician that sprinkles fairy dust on people. Poof, they're better. It doesn't work that way. And you know that. Deep down, I know you know that because you've suffered long enough. Because I've been working with fibromyalgia patients since I started my practice. And I've helped a lot of people. A lot of people. So I'm Dr. Michael Johnson. If you're interested, contact me. We can set up a consultation, drmlj83@gmail.com. Have a wonderful day, and I look forward to helping you in the future.